I'm a fellow of the RACGP and have spent years working in primary care, where efficiency, accuracy, documentation really matter. Like many clinicians, I was using multiple analog tools every day and seeing how limited they were, particularly when it came to visualizing findings, documenting them properly, or explaining them to patients. Over time, it became clear that the tools hadn't kept pace with modern practice expectations. So I decided to build something new that addressed those gaps in a practical, clinician-led way. The biggest issues was the disconnect between high-quality clinical care and the evidence we relied on to support it. Clinicians are under pressure to see more patients, manage more complexity, and meet higher documentation standards, often with outdated tools. In areas like skin, ear, and eye assessments, we rely heavily on subjective descriptions, which can be vulnerable over time. I wanted to help clinicians generate clearer, more objective records without adding friction to the workflow. Smartphone attachments can seem convenient, but personal devices were never designed for medical imaging or long-term clinical governance. They introduce privacy, security, and data integrity risks, particularly around storage backups and image processing. From a practice and medico-legal perspective, that creates uncertainty. The iScope was designed as a dedicated medical device with clinical documentation and governance in mind from the outset. The iScope combines an ophthalmoscope, otoscope, and dermatoscope with medical microscope capability into one portable device. It allows clinicians to capture and review images at the point of care and use those images to support documentation, patient education, and referrals. The goal was not to replace clinical judgment, but to give clinicians better tools to support it. Patients benefit from clearer explanations and greater transparency. When clinicians can show whatever they are seeing rather than just describing it, conversations become more collaborative. It supports shared decision-making and helps patients better understand why a particular management plan or referral is recommended. By consolidating tools and integrating imaging into the consultation, clinicians can reduce duplications, shorten explanation, and document more efficiently. In some cases, it may also support managing more care within the practice rather than defaulting to referrals, which can improve access for patients and workflow sustainability for clinics. Ultimately, it's about helping clinicians work smarter within existing constraints. In Australia, compliance and audits are rarely about intent, they're about evidence. Documentation needs stands up years later, often long after the consultation has taken place. Visual evidence can strengthen clinical records when used appropriately, particularly in high-risk areas like dermatology and ENT. The iScope was built to support that reality, not to add complexity. Access to specialists can be limited in rural and regional areas. Better imaging can support clearer triage, higher quality referrals, and in some cases, remote consultations or advice. While it doesn't replace specialist care, it can help ensure patients receive timely and appropriate management closer to home where possible. The feedback has been encouraging. Clinicians resonate with the problem because it reflects their daily experience. Many appreciate that the iScope was designed by someone who understands the realities of practice, rather than as purely a technical solution looking for a case. Our focus is on careful, responsible launch and ongoing clinical engagement. We are continuing to refine the product based on real-world feedback and ensuring it integrates well into Australian practice workflows. Longer term, the goal is to keep building tools that genuinely support clinicians and improve the standard of care in practical, measurable ways.